Your Jacks Fantasy Football's Injury Report featuring Dr. Kevin Kaplan is brought to you each week by TWS Jacksonville. Experience the opportunity to start a career in as little as 7 months. Dr. Kevin Kaplan of JOI, orthopedic surgeon specializing in sports medicine. I'm going to get the number right, 346-3465. How's that?
That's it. We got it this week.
One of the Jacksonville Jaguars team doctors from JOI, and we got the injury report. Again, we always like to give the fantasy angle, but with the first one we're going to get into, it's a quarterback and it's a hamstring, and I'm just curious from Matt Stafford's standpoint, can that affect a quarterback maybe more than other positions?
I think it can affect a quarterback in terms of his mobility. I think that the team obviously is going to play him. He's going to play, and they're probably going to have to do a lot more keeping him in the pocket, handing it off a lot more to the running back. An injury like that is going to affect the way he can scramble out of the pocket and the way he can push off and get away from defenders that are coming in. So.
And he's not a terribly mobile quarterback to start with, so ideally he just can stand in that pocket and the defensive line keeps him upright.
Yeah, and as long as they treat him, and I'm sure they've been doing a good job in the locker room, the training room, treating him all week. So he may be sore, but he's going to get out there. He's going to be able to throw the ball. It's just a matter of the one or two times they flush him out of the pocket, he may go down. He may not be able to get away from the defender. So.
Well, Mike Dempsey talking a lot about that crowded Buffalo running back field. C.J. Spiller had a knee in the first week, went down. Fred Jackson did. C.J. Spiller comes in, and all of a sudden he now has a shoulder injury. And they said from an MRI, no damage, and he could play, but they said at least it's only a week, maybe 2 weeks.
So most of the time when we get MRIs on athletes after they injure themselves, we look for structural damage. We look at the rotator cuff tendons, which are the tendons surrounding the ball and socket, and we look at the cartilage in the shoulder joint. If all that checks out normal, then you can have just an injury to the ligaments, you can have a bone bruise, and those are all injuries that are week to week, almost day to day, in terms of whether or not they can get out there. If nothing is structurally wrong, they're not going to dislocate their shoulder, they're able to move their arm, they have the strength in their arm, they can get out there and play, whether or not they're having a little bit of discomfort or not.
And Fred Jackson, in his case, he tells everyone in the media, I'm 75%, I'm going to go. You hear it from the player, yes. Doctor's story a little different.
You got to protect the player. I mean, every player wants to get out there and play. These guys are out there because they want to win, they want to play hard. But from a physician standpoint, we have to make sure they have all their motion, they have all their strength, so that when they go out there and they get hit by these huge guys, that they're not going to damage themselves further. And the investments that the teams have put into these guys are not going to risk that.
Next couple on this list, I want to bring up, with regards Matt Forte, and even an Aaron Hernandez. Both of them have ankle. In fantasy world, everyone immediately goes to, is it low or high? Is there that much of a difference, and what are the timelines for them?
Huge difference between ankle sprains, high and low. We'll break it down to you real simply. The tibia and the fibula are the two bones of the lower leg, and those are connected to the bones in the foot by ligaments. Low ankle sprains, or normal ankle sprains, are those ligaments that involve the fibula going down towards the rest of the bones in the foot. The high ankle sprains are the ligaments that connect the tibia and the fibula. Those take much longer to recover from, on the order of 6 weeks, sometimes even longer. Some people get back quicker, but in general, for your fantasy football teams, if you hear high ankle sprains, those are the ones that are going to be a little bit longer because they involve the ligaments between those two bones.
And the Bears have a bye week in week number 6. Matt Forte got injured in week 1, and they immediately came out and said it could be post-bye week, which would be week 7, which would fit your 6-week timetable.
Absolutely correct.
Aaron Hernandez, again, they said it was low. Hopefully, another couple weeks. I got him everywhere. I need him. I need him, Doc.
Low ankle sprains can come back quicker, so I think you'll be all right with him. I think he'll come back much quicker.
Wrapping it up, we have we have a Reggie Bush. He was really productive, and you hate to see it. He goes down with a knee, and varying degrees of knee, obviously, but he also had an MRI, and they said he could get back out there this week.
And this was his operated on knee, I believe. It was his left knee, and he had in 2009 had a microfracture of his left knee. So if it's the same knee, structurally everything's okay, but you got to worry about the cartilage in his knee. So if it's swelling, if they got the MRI and the ligaments look fine, you worry a little bit about cartilage. So right now what they're probably doing with him is they're treating the swelling, they're treating the inflammation, and trying to get him back out there.
You heard from Mike Dempsey in the second segment. It's Lamar Miller that he's intrigued by, and Daniel Thomas, Reggie Bush, that could come back to haunt him all season long. Dr. Kaplan, JOI, 346-3465. Go find him. one of the team doctors for the Jacksonville Jaguars. Thanks again, Doc.
Thanks for having me.
We'll see you next week. Fantasy football back with the fourth quarter right after this.